SI joint and piriformis get lost. My therapy for plaque pain and nerve chairs. Overview of sacroiliac joint syndrome, SI joint syndrome, and piriformis syndrome. Overview of sacroiliac joint syndrome, SI joint syndrome, and piriformis syndrome. Sacroiliac joint syndrome, SIJ syndrome. Sacroiliac joint syndrome refers to pain in the area of the sacroiliac joint, which is located between the sacrum and the ilium. Causes can be overuse, injuries, poor posture or inflammation. Symptoms include pain in the lower back, buttocks or legs, stiffness and limited mobility. Diagnosis is made by clinical examination. Imaging procedures such as X-rays, MRI or CT can be used for confirmation. Piriformis syndrome. Piriformis syndrome refers to discomfort caused by the piriformis muscle, which is located deep in the gluteal area and crosses the sciatic nerve. The main cause is irritation or compression of the sciatic nerve by the piriformis muscle. Symptoms include pain in the buttocks that may radiate down the leg, sciatica, numbness, tingling, and muscle weakness. The diagnosis is often made clinically, but imaging studies may be used for further evaluation if necessary. These two syndromes cause similar symptoms, but their causes and treatments may vary. Goal of self-treatment. The goal of self-treatment for sacroiliac joint syndrome, SI joint syndrome, and piriformis syndrome is to reduce pain, improve mobility, and restore functionality to the affected area. Here are some specific goals. Pain relief. Reduction of acute pain in the area of the sacroiliac joint and the piriformis muscle through various treatment methods. Reducing inflammation and irritation that can contribute to pain. Improving mobility. Increase flexibility and freedom of movement in the area of the sacroiliac joint and the piriformis muscle. Reduction of stiffness and limitations in everyday movement such as walking, bending and sitting. Strengthening and stabilization. Strengthening the surrounding muscles to support and stabilize the sacroiliac joint and the piriformis muscle. Improve posture and muscle balance to prevent future injuries. Self-management. Teaching techniques and exercises that patients can perform independently to control and improve their symptoms. Promoting self-responsibility and empowerment in dealing with chronic pain and discomfort. Long-term prevention. Development of a holistic approach to long-term prevention of relapses and promotion of sustainable musculoskeletal health. Training in healthy lifestyle habits, including proper nutrition, regular exercise, and stress management. The goal of self-care is to help patients become active participants in their recovery and take control of their health. It is about considering individual needs and goals and taking a holistic approach to improving well-being. Basic knowledge. Basic knowledge about sacroiliac joint syndrome, SI joint syndrome, and piriformis syndrome includes the following points. Anatomy of the sacroiliac joint and the piriformis muscle. The sacroiliac joint, SI joint, is located between the sacrum and the two ilium bones and plays an important role in transferring loads from the upper body to the legs. The piriformis muscle is a small but important muscle in the gluteal area that lies deep beneath the gluteus maximus and crosses the sciatic nerve. Causes of sacroiliac joint syndrome and piriformis syndrome. SI joint syndrome can be caused by various factors, including injury, overuse, poor posture, pregnancy or inflammation. In piriformis syndrome, irritation or compression of the sciatic nerve by the piriformis muscle can occur, causing pain in the buttocks and along the nerve. Symptoms of sacroiliac joint syndrome and piriformis syndrome. Common symptoms of sacroiliac joint syndrome include pain in the lower back, buttocks and legs, stiffness and limited mobility. Piriformis syndrome manifests itself in pain in the buttocks that can radiate along the sciatic nerve into the leg, accompanied by numbness, tingling and muscle weakness. Diagnosis and differential diagnosis. The diagnosis of sacroiliac joint syndrome and piriformis syndrome is based on a thorough medical history, physical examination and, if necessary, imaging procedures such as X-rays, MRI or CT. It is important to rule out other possible causes of similar symptoms, such as herniated discs, arthritis or muscular dysfunction. A solid understanding of the anatomy, causes, symptoms and diagnostic procedures is crucial for the successful treatment and self-management of sacroiliac joint syndrome and piriformis syndrome. Anatomy of the sacroiliac joint and the piriformis muscle. The anatomy of the sacroiliac joint and piriformis muscle is crucial to understanding sacroiliac joint syndrome and piriformis syndrome. Here is a brief description. Sacroiliac joint, SI joint. The sacroiliac joint, SI joint, is a connection between the pelvis, ilium, and the sacrum. It is an amphiarthrotic joint, which means that it is partially mobile. The sacroiliac joint plays an important role in transmitting forces between the trunk and lower extremities during walking, standing, and other movements. The structures surrounding the sacroiliac joint include ligaments, muscles and fascia that contribute to the stability and function of the joint. Piriformis muscle. The piriformis muscle is a small, flat muscle that lies deep in the gluteal area. It runs from the front of the sacrum to the upper end of the thigh bone, femur. The piriformis muscle plays an important role in external rotation of the hip joint and in stabilizing the pelvis during walking and standing. The sciatic nerve runs in close proximity to the piriformis muscle and can be affected by tension or irritation of the muscle, causing pain and symptoms of piriformis syndrome. Understanding the anatomy of the sacroiliac joint and piriformis muscle is crucial to understanding the mechanisms and causes of lower back and buttock pain and to developing appropriate treatment approaches. Causes and symptoms of sacroiliac joint syndrome and piriformis syndrome. The causes and symptoms of sacroiliac joint syndrome, SI joint syndrome, and piriformis syndrome are similar, but may also have specific differences. Here is a brief description. Causes of sacroiliac joint syndrome. Overload of the sacroiliac joint due to repetitive strain or traumatic injury. Incorrect posture, such as a tilted pelvis or a rotation of the pelvis, which can lead to an uneven load on the joint. Pregnancy, during which hormonal changes and the additional weight of the fetus can put strain on the sacroiliac joint. Inflammatory diseases such as sacroiliitis or spondylitis, which can lead to irritation of the joint. Symptoms of sacroiliac joint syndrome. Pain in the lower back, buttocks, or groin area that may extend to one or both sides. Stiffness and limited mobility in the sacroiliac joint area, especially when standing from a sitting position or when bending over. Pain when walking, standing or sitting for long periods of time. Possibly also pain that spreads into the legs or upper back. Causes of piriformis syndrome. Tension or injury to the piriformis muscle due to overuse or traumatic events. Anatomical variations that may lead to irritation or compression of the sciatic nerve by the piriformis muscle. Muscle imbalances or dysfunctions in the pelvic area that can strain the piriformis muscle. Symptoms of piriformis syndrome. Pain in the buttocks area, which often radiates into the leg and can run along the course of the sciatic nerve. Numbness or tingling in the affected leg. Muscle weakness in the buttocks or legs, especially when walking, climbing stairs or sitting. Discomfort may worsen when pressure is placed on the piriformis muscle, such as when sitting on a hard chair or when walking. The exact causes and symptoms can vary from person to person, and a thorough examination is important to make an accurate diagnosis and develop an appropriate treatment plan. Diagnosis and differential diagnosis. The diagnosis and differential diagnosis of sacroiliac joint syndrome, SI joint syndrome, and piriformis syndrome requires a careful history, physical examination and, if necessary, imaging studies. Here is a brief explanation. Diagnosis of sacroiliac joint syndrome and piriformis syndrome. A detailed medical history is taken to determine the symptoms, their duration and triggers. The physical examination focuses on the lower back, buttocks and legs to identify pain points, limited mobility and muscular imbalances. Specific tests can be performed to evaluate the functionality of the sacroiliac joint and the piriformis muscle, such as the Gienslen or Lasagou tests. In addition, imaging techniques such as X-rays, MRI or CT can be used to identify structural changes in the area of the sacroiliac joint or the piriformis muscle. Differential diagnosis. It is important to rule out other possible causes of similar symptoms, such as herniated discs, arthritis, hip problems or muscular dysfunction. Differential diagnosis can be made through additional tests, clinical observations and examinations, and collaboration with other specialists to ensure an accurate diagnosis. A holistic view of the symptoms and their connection to other health problems can help facilitate the differential diagnosis and develop the right treatment strategy. Diagnosis and differential diagnosis require a careful evaluation of symptoms and a thorough examination by a qualified specialist, such as an orthopedic surgeon, neurologist or physical therapist. An accurate diagnosis is crucial for developing an effective treatment plan and relieving the symptoms of sacroiliac joint syndrome and piriformis syndrome. New therapeutic approaches. New therapeutic approaches for sacroiliac joint syndrome, SI joint syndrome, and piriformis syndrome include several innovative approaches to treating and relieving symptoms. Here are some promising therapeutic approaches. Regenerative medicine. The use of regenerative therapies such as stem cell therapy or platelet-rich plasma, PRP, to promote healing and regeneration of damaged tissue in the area of the sacroiliac joint or piriformis muscle. These approaches can reduce inflammation, improve blood circulation and promote tissue regeneration. Minimally invasive interventions. Minimally invasive procedures such as injections of local anesthetics, steroids or botulinum toxin directly into the area of the sacroiliac joint or piriformis muscle can be used to relieve pain and improve functionality. Radiofrequency ablation, RFA, or thermal neurolysis can be used to destroy nerve endings and block pain transmission. Biomechanical therapy approaches. Approaches that focus on correcting muscular imbalances, poor posture and movement patterns to reduce stress on the sacroiliac joint and piriformis muscle. Use of specific exercises, functional movement therapy and manual techniques to improve mobility and stability in the lower back and pelvic area. Neurological interventions. Neuromodulation techniques such as transcutaneous electrical nerve stimulation, TENS, or percutaneous nerve stimulation, PNS, to influence pain transmission and modulate pain perception, neurological rehabilitation and neuromuscular reorganization techniques to improve neuromuscular function and control and relieve pain, integrative treatment approaches, holistic approaches that combine different therapies and modalities such as physical therapy, osteopathy, acupuncture, chiropractic, massage therapy and yoga. Individualized treatment plans tailored to the patient's specific needs and preferences to promote comprehensive and holistic recovery. These new therapeutic approaches offer promising options for the treatment and self-management of sacroiliac joint syndrome and piriformis syndrome by integrating innovative technologies, biological approaches and holistic treatment methods. However, it is important that these approaches are used under the guidance of a qualified specialist or therapist to ensure safety and effectiveness. Introduction of new treatment methods for the sacroiliac joint and the piriformis muscle. Here are some new treatment methods for the sacroiliac joint, SI joint, and piriformis muscle. Biological therapies. The use of regenerative medicine approaches such as stem cell therapy, platelet-rich plasma, PRP, and growth factors to promote healing of tissue damage in the area of the sacroiliac joint and piriformis muscle. These approaches aim to reduce inflammation, support tissue regeneration and relieve symptoms. Minimally invasive techniques. Interventional procedures such as injections of local anesthetics, steroids or botulinum toxin directly into the area of the sacroiliac joint or piriformis muscle to relieve pain and improve functionality. Newer techniques such as radiofrequency ablation, RFA, ultrasound or laser therapy can also be used to block pain transmission and reduce symptoms. Biomechanical approaches. The integration of biomechanical therapy approaches such as manual therapy, functional movement therapy and muscular rehabilitation to correct poor posture, muscular imbalances and movement restrictions. Targeted exercises and techniques can help improve the stability and mobility of the SI joint and piriformis muscle and reduce symptoms. Neuromodulation techniques. The use of neuromodulatory techniques such as transcutaneous electrical nerve stimulation, TENS, or percutaneous nerve stimulation, PNS, to modulate pain perception and relieve pain. Newer approaches to spinal cord stimulation or peripheral nerve stimulation can also be used to influence pain transmission and control symptoms. Integrative therapy approaches. The combination of different therapy methods and modalities, such as physiotherapy, osteopathy, acupuncture, chiropractic, massage therapy and yoga, in a holistic treatment approach. Individualized treatment plans tailored to the patient's specific needs and preferences to promote comprehensive recovery. These new treatments offer promising approaches to treating and self-treating SI joint and piriformis muscle conditions by integrating innovative technologies, biological approaches and holistic therapies. However, it is important that these approaches are used under the guidance of a qualified medical professional or therapist to ensure safety and effectiveness. Current research results and developments in therapy. Current research and developments in the treatment of sacroiliac joint syndrome, SI joint syndrome, and piriformis syndrome offer promising insights and new treatment options. Here are some important research areas and developments. Genetic influences and biomarkers. Studies to identify genetic factors that may increase the risk for sacroiliac joint syndrome and piriformis syndrome. Research to discover biomarkers in the blood or tissue that indicate inflammation, tissue damage or neurological changes and can be used to diagnose and monitor disease progression. Neurophysiological mechanisms. Studies to elucidate the neurophysiological mechanisms causing pain in the sacroiliac joint and piriformis muscle, including the role of nerve irritation, inflammation, and muscular dysfunction. Research to identify neural circuits and brain regions involved in pain processing in order to develop new therapeutic approaches. Regenerative medicine and tissue regeneration. Advances in regenerative medicine, including the use of stem cells, growth factors and biomaterials, to promote healing and regeneration of damaged tissue in the SI joint and piriformis muscle region. Studies to optimize therapy protocols and improve the long-term results of regenerative therapies. Imaging and diagnostics. Further development of imaging techniques such as magnetic resonance imaging, MRI, computed tomography, CT, and ultrasound for more precise diagnosis and visualization of structural changes in the area of the sacroiliac joint and the piriformis muscle. Research into the development of novel imaging biomarkers and diagnostic procedures that enable early detection and differentiated diagnosis. Personalized therapy approaches. Research to develop personalized therapeutic approaches targeting individual genetic, anatomical and pathophysiological characteristics. Studies to identify patient profiles and clinical characteristics that enable targeted treatment and improved clinical efficacy. These research findings and developments help to deepen the understanding of sacroiliac joint syndrome and piriformis syndrome and to explore new therapeutic options that could enable effective treatment and improved outcomes for affected patients. Exercises for muscle strengthening for the sacroiliac joint and the piriformis muscle. Here are some muscle strengthening exercises specifically designed for the sacroiliac joint and piriformis muscle. Bridge. Glute bridge. Lie on your back with your knees bent and your feet flat on the floor. Slowly lift your pelvis off the floor by tightening your glutes until your body forms a straight line from your knees to your sacroiliac joints. Hold the position for a few seconds and then lower your pelvis again. Repeat the exercise for several repetitions. Side leg circles. Lie on your side and support yourself on your forearm while your upper leg is stretched out. Slowly lift the upper leg and make small circles in the air. Keep the abdominal muscles engaged to improve stability. Perform the exercise in both directions and then switch sides. Knee to chest. Lie on your back and gently pull one knee toward your chest while keeping the other leg on the floor. Hold the position for about 20-30 seconds while feeling a stretch in the gluteal area. Then switch sides and repeat the exercise with the other leg. Superman exercise. Lie on your stomach with your arms and legs stretched out. At the same time, lift your arms, head and chest off the floor and stretch your legs backwards. Hold the position for a few seconds while tightening your glutes. Then slowly return to the starting position. Repeat the exercise several times. Piriformis stretch. Sit on the floor and cross one leg over the other so that the ankle rests on the opposite thigh. Lean your upper body forward while keeping your back straight until you feel a stretch in the buttock of the crossed leg. Hold the stretch for about 20-30 seconds and then switch sides. It is important to perform these exercises slowly and in a controlled manner and to listen to your body. Start with an appropriate number of repetitions and gradually increase the intensity and volume to avoid overloading. If you have any discomfort or are unsure, Please consult a qualified physical therapist or doctor before starting any new exercise program. Stretching exercises for the sacroiliac joint and the piriformis muscle. Here are some stretches specifically designed for the sacroiliac joint and piriformis muscle. Piriformis stretch. Sit on the floor and extend one leg forward while the other leg is bent and the foot is placed next to the opposite knee. Turn your upper body to the bent side and place the opposite elbow on the outside of the bent knee. Increase the stretch by leaning your upper body slightly forward while keeping your back straight. Hold the position for 20-30 seconds and then switch sides. Knee to SI joint stretch. Lie on your back and bend one knee toward your stomach while the other leg remains stretched on the floor. Grasp the bent knee with both hands and pull it gently towards the opposite sacroiliac joint. Hold the position for 20-30 seconds while feeling a stretch in the glute area. Then switch sides. Sacrum stretch. Figure 4 stretch. Lie on your back and bend both knees with your feet flat on the floor. Cross your right leg over your left knee so that your right ankle rests on your left thigh. Reach through the opening between the legs and pull the left leg toward the torso. Hold the position for 20-30 seconds and then switch sides. Piriformis stretch while standing. Stand upright and place one leg over the other with the ankle resting on the thigh of the other leg. Bend the knee of your standing leg slightly and lower your upper body forward while keeping your back straight. Hold the position for 20-30 seconds while feeling a stretch in the glute area. Then switch sides. Cat-cow stretch. Get on all fours and place your hands under your SI joints and your knees under your hips. Inhale and lower your stomach down while lifting your head and buttocks up. Cow position. Exhale and round your back upward by pulling your chin to your chest and pressing your buttocks to the floor. Cat position. Alternate between these positions and perform them several times to mobilize the spine and stretch the piriformis muscle. Perform these stretches slowly and in a controlled manner, holding each stretch for 20-30 seconds for maximum effect. It is important to listen to your body and only perform stretches to a point of comfort without causing pain. If you experience any discomfort or are unsure, please consult a qualified physical therapist or doctor before starting any new stretching program. Strengthening exercises to stabilize the joint. Here are some strengthening exercises to stabilize the sacroiliac joint, SI joint, and support the piriformis muscle. Hip thrust. Sit on the floor and lean your upper back against a bench or raised piece of furniture. Place a weight on your pelvis or use your own body resistance. Press through your heels to lift your pelvis up until your body forms a straight line from your knees to your sacroiliac joints. Tighten your gluteal muscles and hold the position for 1 second. Lower your pelvis in a controlled manner and repeat the movement. Side lunges. Stand upright with your feet approximately SI joint width apart. Take a big step to the side and lower yourself into a lunge position, shifting your weight onto the bent leg. Keep the other leg straight and make sure that the knee does not extend beyond the toes. Then push yourself back to the starting position with the bent leg and repeat the exercise on the other side. Single leg deadlift. Stand upright with your knees slightly bent and one foot slightly raised. Slowly bend forward while extending the raised leg backward, keeping your back straight. Lower your upper body until it is parallel to the floor. Then return to the starting position by lifting your hips and maintaining balance. Repeat the movement on the same leg and then switch sides. Stabilizing plank variations. Assume the plank position, either on your forearms or on your hands. Tighten your abdominal muscles and glutes to keep your body in a straight line. Vary the planks by, for example, lifting one leg, bringing the knees alternately to the elbow, or doing side planks to improve the stability of the trunk and the SI joint. Piriformis side press. Lie on your side and support yourself on your forearm with your upper leg slightly bent. Slowly lift the lower leg off the floor and then lower it in a controlled manner without touching the floor. Be careful not to rotate your hips and perform the movement from your buttocks to activate the piriformis muscle. Repeat the movement several times and then switch sides. These exercises aim to improve the stability of the sacroiliac joint, strengthen the surrounding muscles and support the piriformis muscle. It is important to perform the exercises slowly and with control and to ensure correct form to avoid injury. If you are new to performing exercises or have any discomfort, please consult a qualified physical therapist or doctor before starting a new exercise program. Mobilization exercises to improve mobility. Here are some mobilization exercises to improve mobility in the sacroiliac joint, SI joint, and piriformis muscle. Cat-cow stretch. Get on all fours and place your hands under your SI joints and your knees under your hips. Inhale and lower your stomach down while lifting your head and buttocks up. Cow position. Exhale and round your back upward by pulling your chin to your chest and pressing your buttocks to the floor. Cat position. Alternate between these positions and perform them several times to mobilize the spine and improve flexibility in the SI joint area. Rotational movement while lying down. Lie on your back and bend your knees while keeping your feet flat on the floor. Slowly allow both knees to fall to the side to achieve rotation in the lower back and sacroiliac joint. Hold the position for a few seconds and then return to the starting position. Perform the movement on both sides to improve mobility in the SI joint area symmetrically. Piriformis stretch while lying down. Lie on your back and bend your knees while keeping your feet flat on the floor. Cross your right leg over your left knee and grab your left leg with both hands. Slowly pull the left leg toward the chest while pushing the right foot slightly outward to feel a stretch in the piriformis muscle. Hold the position for 20-30 seconds and then switch sides. Hip circles in quadruped position. Get on all fours and place your hands under your SI joints and your knees under your hips. Make slow, controlled circular movements with your hips, moving your knee outward and then backward. Perform the movement several times in both directions to improve mobility and flexibility in the hip joint and the sacroiliac joint area. ISG bridge with rotation. Lie on your back with your knees bent and your feet flat on the floor. Slowly lift your pelvis off the floor to achieve a bridge position. Slowly rotate your upper body to the side while keeping your pelvis raised to achieve additional rotation in the lower back and sacroiliac joint area. Hold the position for a few seconds and then return to the starting position. Repeat the exercise on the other side. These mobilization exercises aim to improve mobility in the sacroiliac joint and piriformis muscle area by mobilizing the surrounding muscles, ligaments and joints. Perform these exercises slowly and in a controlled manner, taking care not to cause pain. If you are unsure or experience any discomfort, please consult a qualified physical therapist or doctor before starting any new mobility program. Alternative remedies. Alternative remedies can be used to relieve symptoms associated with sacroiliac joint syndrome, SI joint syndrome, and piriformis syndrome. Here are some alternative approaches. Acupuncture. This traditional Chinese therapy method involves inserting fine needles at specific points along the body's meridians to regulate energy flow and relieve pain. Acupuncture can be used in the treatment of SI joint syndrome and piriformis syndrome to relieve pain and improve muscular dysfunction. Chiropractic. Chiropractors use manual techniques to correct spinal and joint blockages and improve nervous system function. By making adjustments to the spine and pelvis, chiropractors can help improve the alignment of the SI joint and reduce tension in the piriformis muscle. Osteopathy. Osteopaths use a holistic approach to improve the health and function of the body. Through gentle manual techniques such as mobilization and manipulation, osteopaths can help reduce tension in the SI joint and piriformis muscle area and improve mobility. Herbal medicine. Some herbs and plant extracts may have anti-inflammatory and pain-relieving properties that may help treat SI joint syndrome and piriformis syndrome. These include herbs such as arnica, devil's claw, frankincense, and turmeric. However, it is important to consult with a doctor or herbalist before taking herbal medicine to consider any potential interactions or side effects. Homeopathy. Homeopathic remedies can be used to treat pain and inflammation associated with sacroiliac joint syndrome and piriformis syndrome. Individually selected homeopathic medicines can help activate the body's self-healing powers and alleviate symptoms. Individual advice from an experienced homeopath is advisable. Massage therapy. Targeted massage techniques can help to relieve tension and adhesions in the area of the piriformis muscle and the sacroiliac joint. By improving blood circulation and loosening the muscles, massage therapy can help relieve pain and improve mobility. It is important to note that while alternative remedies can help relieve symptoms and improve health, they should not be used as a substitute for appropriate medical treatment. Before using alternative therapies, it is advisable to consult with a qualified medical professional or therapist. Which vitamins, minerals or trace elements can help? Some vitamins, minerals and trace elements can help support muscle, joint and connective tissue health, which may also be helpful for conditions related to sacroiliac joint syndrome, SI joint syndrome, and piriformis syndrome. Here are some that may play a role. Vitamin D. Adequate levels of vitamin D are important for bone health and muscle contraction. Supplementation can help, especially if there is a deficiency. Calcium. Calcium is crucial for bone health and can help maintain bone strength. It can be taken in combination with vitamin D to support better absorption. Magnesium. Magnesium is important for muscle relaxation and can help prevent muscle cramps. It may also have anti-inflammatory properties that can help relieve pain. Omega-3 fatty acids. These essential fatty acids have anti-inflammatory properties and can help reduce inflammation in the body. They are found in fish oil, flaxseed oil and walnuts. Vitamin C. Vitamin C is important for collagen production, the main protein in connective tissue that is important for the health of tendons, ligaments and cartilage. Zinc. Zinc plays a role in collagen production and can therefore contribute to the health of connective tissue. It is also important for the immune system and wound healing. B vitamins. B vitamins such as vitamin B6 and B12 are important for energy metabolism and can help reduce muscle cramps. Manganese. Manganese is a trace element that is involved in the formation of cartilage and bones and can therefore contribute to joint health. It is important to note that a balanced diet rich in fruits, vegetables, whole grains, Lean protein and healthy fats is the best source of most nutrients. Taking supplements should be done taking into account individual needs and in consultation with a doctor or nutritionist to avoid overdose or interactions with other medications. Which Schussler salts can help? Schussler salts are a form of alternative medicine based on the belief that diseases are caused by a lack of certain mineral salts in the body. Some Schussler salts could potentially help with conditions related to sacroiliac joint syndrome, SI joint syndrome, and piriformis syndrome by balancing the mineral levels in the body. Here are some to consider. Schussler salt No. 1. Calcium fluoritum. Calcium fluoride. This salt is often used to strengthen connective tissue and ligaments. It can help to improve the elasticity of the connective tissue and thus support the flexibility of the sacroiliac joint. Schussler salt No. 2. Calcium phosphoricum. Calcium phosphate. Calcium phosphoricum is important for bone health and energy metabolism. It can help promote bone regeneration and improve muscle strength. Schussler salt No. 7. Magnesium phosphoricum. Magnesium phosphate. Magnesium phosphoricum is known for its relaxing effect on the muscles. It can relieve muscle cramps and tension, which can be helpful for complaints in the piriformis muscle area. Schussler salt number 8. Sodium chloritum. Table salt. Sodium chloritum is important for the fluid balance in the body and can help regulate the water balance. Adequate fluid intake is important for the health of connective tissue and joints. Schussler salt No. 11. Silicia. Silica. Silicia is often used to strengthen connective tissue, skin, hair and nails. It can help to improve the structure and strength of the connective tissue and thus support the stability of the sacroiliac joint. Schussler salt No. 12. Calcium sulfuricum. Calcium sulfate. Calcium sulfuricum can have anti-inflammatory properties and be helpful in treating inflammation in the area of the sacroiliac joint and the piriformis muscle. It is important to note that the use of Schussler salts can be individual and vary from person to person. It is recommended to consult with a doctor or an experienced homeopath before taking Schussler salts to determine the correct dosage and use and to consider possible interactions with other medications. Which acupressure points can I use? Acupressure is a traditional Chinese technique that involves applying pressure to specific points along the body's meridians to relieve pain and improve overall well-being. Here are some acupressure points that may help with conditions related to sacroiliac joint syndrome, SI joint syndrome, and piriformis syndrome. Bladder 15. Bladder 15. This point is located on the back of the body, approximately halfway between the sacroiliac joints. Pressure on this point can help release tension in the upper back and neck that may be affecting the SI joint. BL 23. Bladder 23. This point is located along the spine, approximately at waist level. Pressure on this point can help relieve tension in the lower back and improve stability of the SI joint. GB 30. Gallbladder 30 or Huan Shao. This point is located on the side of the buttocks, about halfway between the hip and the tailbone. Pressure on this point can help relieve pain in the buttocks and piriformis muscle. BL 40. Bubble 40 or Weizhong. This point is located on the back of the knee, approximately in the middle of the back of the knee. Pressure on this point can help relieve lower back and buttock pain that may originate from the SI joint or piriformis muscle. GB 34. Gallbladder 34 or Yangling Quan. This point is located on the outside of the lower leg, about 2 finger widths above the outer ankle. Pressure on this point can help relieve lower back, buttock and leg pain that may be associated with sacroiliac joint syndrome or piriformis syndrome. To stimulate these acupressure points, you can apply gentle to moderate pressure with your fingertips or thumbs and make circular movements or hold the pressure for a few minutes. Which herbs or teas can help? Some herbs and teas may have anti-inflammatory, analgesic and relaxing properties that may help with discomfort associated with sacroiliac joint syndrome, SI joint syndrome, and piriformis syndrome. Here are some herbs and teas that may be helpful. Ginger. Ginger is known for its anti-inflammatory properties and can help relieve pain in the back and buttocks area. You can make ginger tea by steeping fresh ginger in hot water or incorporate ginger as a spice into your meals. Turmeric. Turmeric contains the active ingredient curcumin, which has powerful anti-inflammatory properties. Turmeric can help reduce inflammation in the body and thus relieve pain associated with SI joint syndrome and piriformis syndrome. You can use turmeric as a spice or make turmeric tea. Nettle. Nettle leaves contain various nutrients and compounds that may have anti-inflammatory and pain-relieving properties. Nettle tea may help reduce inflammation and support overall muscle and joint health. Willow bark. Willow bark contains salicin, a natural compound that has anti-inflammatory and pain-relieving properties, similar to aspirin. Willow bark tea may be helpful in relieving pain associated with SI joint syndrome and piriformis syndrome. Lavender. Lavender has calming and relaxing properties that can help relieve tension and stress. Lavender tea can help promote relaxation and relieve pain caused by muscle tension and stress. Chamomile. Chamomile has anti-inflammatory and soothing properties and can help relieve pain and inflammation. Chamomile tea can help relieve muscle tension and promote relaxation. Green tea. Green tea contains antioxidants and anti-inflammatory compounds that may help reduce inflammation. Drinking green tea regularly may support overall muscle and joint health. It is important to note that although herbs and teas are natural remedies, they can still have side effects and may not be suitable for everyone. If you have any difficulties or are taking other medications, you should consult with a doctor or qualified herbalist before taking herbs and teas. Use of heat and cold applications. Heat and cold applications can provide effective relief for conditions associated with sacroiliac joint syndrome, SI joint syndrome, and piriformis syndrome. Here are the benefits and uses of heat and cold treatments. Heat applications. Muscle relaxation. Heat increases blood flow and helps relax tense muscles, which can be helpful in relieving pain in the SI joint and piriformis muscle area. Improve blood circulation. Heat promotes blood circulation and the transport of nutrients and oxygen to the affected areas, which can help regenerate tissue. Reducing stiffness. By applying heat, you can reduce stiffness in the muscles and joints and improve mobility in the SI joint area. Applications of heat. Heat packs. Use a hot water bottle, heating pad or warm towel and place it on the affected area for about 15-20 minutes. Warm bath. Take a warm bath with Epsom salt or essential oils to relax muscles and relieve pain. Heat compresses. Use heat compresses or pads that you can warm in the microwave and apply them to the affected area. Cold applications. Pain relief. Cold applications can reduce pain by slowing nerve conduction velocity and numbing pain receptors. Anti-inflammatory. Cold reduces inflammation by reducing blood flow and inhibiting the release of inflammatory substances. Reducing swelling. Cold can help reduce swelling in the SI joint and piriformis muscle area by constricting blood vessels and reducing fluid leakage from the tissues. Applications of cold. Ice pack. Use an ice pack or a towel filled with ice and place it on the affected area for about 10-15 minutes. Be careful not to place the ice directly on the skin to avoid frostbite. Ice packs. Use ice packs or pads that you have chilled in the freezer and apply them to the affected area. Cold baths. Immerse the affected area in a tub of cold water or use cold compresses to relieve pain and inflammation. It is important to alternate heat and cold applications and pay attention to your body's response. Avoid applying heat or cold for long periods of time as this can cause skin damage. If you are unsure which method is best for you, please consult a doctor or physiotherapist. Acupressure and massage to relieve pain. Acupressure and massage can be effective methods for relieving pain associated with sacroiliac joint syndrome, SI joint syndrome, and piriformis syndrome. Here are some techniques that can be used. Acupressure. Lower back pressure points. Use your fingertips or thumbs to gently press along the spine in the lower back. Pay attention to any points that are particularly tender or painful and apply gentle pressure to relieve tension. Points on the buttocks. Look for tender points in the buttocks area, especially along the piriformis muscles. Using your fingertips or thumbs, you can apply gentle pressure there to reduce muscle tension. Along the thighs. Massage along the thigh muscles, especially along the back of the thigh, to relax the muscles and promote blood circulation. Points on the legs. Also massage the legs, especially along the inner and outer thigh muscles, to relieve tension and improve blood flow. Massage. Deep tissue massage. A deep tissue massage can help relieve tension in the SI joint and piriformis muscle area. Use your fingers, thumbs, or elbows to apply pressure to the muscles using long, slow strokes. Cross-friction technique. This technique involves massaging along the muscle strands to break up adhesions and improve circulation. Use your fingers or thumbs to massage along the muscles in circular motions. Trigger point massage. Identify tender points or trigger points in the area of the SI joint and piriformis muscle and massage them gently to reduce muscle tension and relieve pain. Stretching massage. Combine massage with gentle stretches to improve muscle flexibility and promote mobility in the area of the sacroiliac joint and piriformis muscle. It is important to pay attention to your body's response during massage and acupressure and to apply gentle, controlled pressure to avoid injury. If you are unsure or are experiencing severe pain, please consult a qualified physical therapist or doctor before starting treatment. Complementary measures such as acupuncture or chiropractic. Complementary measures such as acupuncture and chiropractic care may be helpful in treating conditions associated with sacroiliac joint syndrome, SI joint syndrome, and piriformis syndrome. Here is an overview of both treatment methods. Acupuncture. Principle. Acupuncture is a traditional Chinese technique that involves placing thin needles at specific points along the body's meridians to regulate energy flow and restore balance in the body. Effect. Acupuncture can relieve pain by stimulating the release of the body's own painkillers such as endorphins and balancing the flow of energy in the body. Treating SI joint syndrome and piriformis syndrome. When treating these conditions, acupuncture focuses on stimulating specific points along the meridians associated with the SI joint. piriformis muscle, and surrounding structures to relieve pain and improve function. Course of treatment. A typical treatment involves a series of sessions, which may vary depending on the individual condition. Typically, the needles are placed for about 20–30 minutes while the patient lies relaxed. Chiropractic. Principle. Chiropractic is an alternative medicine that focuses on the diagnosis, treatment and prevention of musculoskeletal disorders, particularly problems with the spine and joints. Effect. Chiropractic adjustments aim to improve the alignment of the spine and joints to optimize nervous system function, increase mobility, and relieve pain. Treatment of SI joint syndrome and piriformis syndrome. For these conditions, chiropractic can use various techniques such as gentle manipulation, mobilization and stretching to improve the alignment of the SI joint and spine and relax the surrounding muscles. Course of treatment. The number of sessions required and the type of techniques used may vary depending on the individual condition. Typically, treatment involves a series of sessions that occur continuously over a period of time. It is important to consult a qualified practitioner before beginning any acupuncture or chiropractic treatment and to ensure that these treatment methods are appropriate for your specific condition. Practical tips for everyday life. Here are some practical tips for everyday life that can help relieve discomfort associated with sacroiliac joint syndrome, SI joint syndrome, and piriformis syndrome and improve overall health. Workplace ergonomics. Make sure your workstation is ergonomically designed to promote optimal posture and reduce strain on your back and joints. Use an ergonomic chair. Adjust your screen to eye level, and take regular short breaks to stretch and move around. Proper posture. Pay attention to your posture, especially when sitting, standing and lifting heavy objects. Avoid staying in one position for long periods of time and use supportive devices such as lumbar supports or orthopedic pillows when necessary. Regular exercise. Do regular, gentle exercises that improve stability, flexibility and strength of muscles and joints, especially in the pelvic and hip areas. Swimming, cycling, yoga and Pilates can be good options. Weight management. A healthy diet and regular physical activity can help maintain or achieve a healthy body weight, which can reduce pressure on the SI joint and piriformis muscle. Relaxation techniques. Practice relaxation techniques such as yoga, meditation, progressive muscle relaxation or breathing exercises regularly to reduce stress and muscle tension. Heat and cold applications. Use heat and cold applications to reduce pain and inflammation. Use warm compresses or a warm bath to relax tense muscles and apply ice packs if needed to reduce swelling. Good sleep habits. Ensure good sleep quality by using a comfortable mattress and pillows and creating a sleep environment that encourages relaxation and rest. Regular medical checkups. Consult your doctor or physical therapist regularly to monitor your condition. Evaluate treatment progress, and make adjustments to your treatment plan if necessary. By incorporating these practical tips into your daily routine, you can help relieve discomfort, improve the function of your muscles and joints, and improve your overall quality of life. Ergonomic design of the workplace and living environment. Ergonomic design of the workplace and living environment is important to minimize discomfort associated with sacroiliac joint syndrome, SI joint syndrome, and piriformis syndrome and to promote optimal posture. Here are some tips for ergonomic design. Workplace. Chair. Use an ergonomic office chair with adjustable backrest, seat height and armrests. Make sure your back is well supported and your feet are flat on the floor or resting on a footrest. Desk. Adjust your desk so that it is set at the correct height to allow for a neutral arm and hand position when working on your computer. Use a keyboard and mouse pad to support your wrist and reduce strain. Screen. Place your screen at eye level and about an arm's length away to ensure adequate visibility and good posture. Avoid glare and reflections by positioning the screen appropriately. Lighting. Ensure adequate lighting in the workplace to reduce eye strain. Use indirect or natural light to minimize glare. Breaks and movement. Take short breaks regularly to stretch and move. Stand up, walk around and do some simple stretches to improve circulation and relieve muscle tension. Living environment. Furniture. Choose furniture pieces that provide comfort and support, especially in the living room and bedroom. Use comfortable chairs with adequate back and arm support and a mattress and pillows that promote a healthy sleeping position. Floor coverings. Use non-slip carpets or non-slip mats to prevent falls and ensure safety in the living environment. Make sure the floor covering is not too hard to reduce joint stress. Lighting. Make sure all areas of your home are well lit to avoid tripping hazards and improve visibility. Use dimmable lights in the bedroom to create a calming environment for restful sleep. Organization. Keep your living space neat and organized to minimize tripping hazards and create a safe environment. Use furniture with built-in storage to reduce clutter and make it easier to access items. By incorporating these ergonomic principles into your work and home environment, you can help reduce discomfort, improve posture, and create a healthy environment that supports your health and well-being. Avoiding stressful activities and postures. Avoiding stressful activities and postures is crucial to minimizing symptoms associated with sacroiliac joint syndrome, SI joint syndrome, and piriformis syndrome and to promoting muscle and joint health. Here are some tips for avoiding stressful activities and postures. Lifting heavy objects. Avoid lifting heavy objects, especially with incorrect technique. When lifting, bend your knees and use your leg muscles to lift the object rather than straining your back. Sitting for long periods. Avoid sitting in one position for long periods, especially with poor posture. Get up regularly to stretch and move around, and take short breaks to relieve stress on the body. Incorrect posture. Pay attention to your posture when sitting, standing and walking. Avoid slumping or overextending your back and keep your head in a neutral position. Excessive bending. Avoid excessive bending and twisting of the back, especially when lifting or carrying heavy objects. If necessary, use assistive devices such as a belt or stretcher to support the back. High-impact sports. Avoid sports or activities that may cause excessive strain on the sacroiliac joint and piriformis muscle, such as heavy weight lifting, running on uneven terrain, or sudden, jerky movements. Standing for long periods. Avoid standing in one position for long periods, especially on hard surfaces. Use a soft surface or take breaks when necessary to reduce pressure on the joints. Poor sleeping position. Avoid sleeping in awkward positions that can cause strain on the sacroiliac joint and piriformis muscle. Use additional pillows or supportive mattresses if needed to promote a healthy sleeping position. Excessive sitting on one side. Avoid excessive sitting on one side as this can cause imbalance and strain on the sacroiliac joint. Distribute weight evenly on both sides and change sitting positions regularly. By avoiding stressful activities and postures and ensuring that your workplace and living environment are ergonomically designed, you can help reduce discomfort and promote the health of your muscles and joints. Correct posture and movement techniques in everyday life. Proper posture and movement techniques in everyday life are crucial to minimize discomfort associated with sacroiliac joint syndrome, SI joint syndrome, and piriformis syndrome, and to promote muscle and joint health. Here are some tips on correct posture and movement techniques. Correct posture. Standing. When standing, keep your back straight and your SI joints back. Distribute your weight evenly between both feet and avoid standing on one leg. Make sure your knees are slightly bent and your abdominal muscles are slightly contracted. Sitting. Sit with an upright back and your SI joints relaxed. Make sure your feet are flat on the floor or resting on a footrest and your knees are bent at about a 90-degree angle. Use a back brace or pillow to support your lower back. Walking. When walking, keep your head up and your gaze forward. Swing your arms naturally and make sure your steps are even and stable. Avoid excessive forward bending or overextending your back. Movement techniques in everyday life. Proper lifting. When lifting heavy objects, bend your knees. Grip the object firmly and lift it with your leg muscles rather than straining your back. Hold the object close to your body and avoid sudden twisting movements. Climbing stairs. When climbing stairs, hold on to the railing and take each step with both feet. Avoid rushing up the stairs or taking large steps to reduce the risk of falls. Bending. When bending to pick something up from the floor, bend your knees and keep your back straight. Avoid bending from the hips as this can cause strain on the lower back. Carrying loads. Distribute the weight evenly when carrying heavy loads and, if necessary, use aids such as a backpack or trolley to reduce the strain on your back. Balancing exercises. Perform balancing exercises regularly to improve the flexibility, stability and strength of your muscles and joints. This can include exercises such as stretches, strengthening exercises and balance training. By applying these correct posture and movement techniques in your daily life, you can help minimize discomfort, reduce strain on muscles and joints, and improve your health and well-being. Important findings and recommendations for self-treatment. Here are important findings and recommendations for self-treatment of symptoms related to sacroiliac joint syndrome, SI joint syndrome, and piriformis syndrome. Findings. Understanding causes. SI joint syndrome and piriformis syndrome can be caused by various factors such as muscle tension, lack of exercise, poor posture, injury or excessive strain. Holistic approach. A holistic treatment that combines physical exercises, stretches, ergonomic adjustments, relaxation techniques and, where appropriate, complementary therapies can be effective in relieving symptoms and promoting recovery. Individualization. Every patient responds differently to treatments. It is important to try different approaches and choose those that best fit individual needs and preferences. Recommendations for self-treatment. Physical activity. Perform regular, gentle exercises that improve the stability, flexibility and strength of the muscles and joints in the area of the sacroiliac joint and piriformis muscle. Stretching exercises. Incorporate regular stretching exercises into your routine to improve the flexibility of muscles and tendons and promote mobility in the area of the sacroiliac joint and piriformis muscle. Ergonomic adjustments. Design your workplace and living environment ergonomically to promote optimal posture and reduce strain on muscles and joints. Heat and cold applications. Use heat and cold applications to relieve pain and inflammation in the area of the sacroiliac joint and piriformis muscle. Relaxation techniques. Practice relaxation techniques such as yoga, meditation or progressive muscle relaxation regularly to reduce stress and muscle tension. Complementary therapies. Consider complementary therapies such as acupuncture, chiropractic or physical therapy to support treatment and relieve symptoms. Healthy lifestyle. Maintaining a healthy diet, getting enough sleep, managing stress, and avoiding harmful habits such as smoking will help promote overall health and aid recovery. Outlook on further developments in the treatment of the sacroiliac joint and piriformis syndrome. A look ahead to further developments in the treatment of sacroiliac joint syndrome, SI joint syndrome, and piriformis syndrome shows promising approaches for the future. Here are some potential developments. Individualized treatment approaches. Advances in medicine and technology could make it possible to develop treatment approaches that are specifically tailored to the individual needs and characteristics of each patient. This could enable personalized medicine that is more effective and efficient. Further research into therapies. Further research into therapies such as acupuncture, chiropractic, physical therapy, occupational therapy and other alternative treatment methods could lead to a better understanding of their effectiveness and benefits in treating the SI joint and piriformis syndrome. New technologies. The development of new technologies, such as digital health applications, telemedicine, wearables and biofeedback-guided therapies, could help improve the monitoring, diagnosis and treatment of sacroiliac joint syndrome and piriformis syndrome. Research on complementary therapies. Continued research on complementary therapies such as acupuncture, chiropractic, massage, yoga and other alternative approaches could lead to a better understanding of their role in the treatment of musculoskeletal disorders. Regenerative therapies. The advancement of regenerative therapies such as stem cell therapy, PRP, platelet-rich plasma, and regenerative medicine may open up new possibilities for treating tissue damage and inflammation in the area of the SI joint and piriformis muscle. Better understanding of pathophysiology. Advances in understanding the pathophysiology of sacroiliac joint syndrome and piriformis syndrome may help develop targeted therapies that address the underlying causes of the disorders. Overall, there is great promise for the future treatment of the SI joint and piriformis syndrome. Through continued research, innovative technologies and a better understanding of the conditions, new and improved therapies can be developed to help patients improve their quality of life and relieve symptoms. Rights and ownership notice. This audiobook is published and distributed by Testberichtdienste LLC. All copyrights, publishing rights, distribution rights, audio rights, and related intellectual property rights for this work have been lawfully and exclusively acquired by Testberichtdienste LLC. Testberichtdienste LLC is the sole and unrestricted rights holder of this audiobook, including the right to reproduce, distribute, publish, monetize, and publicly perform the content on digital platforms such as YouTube. The original manuscript files, source documents, and contractual acquisition records serve as proof of lawful ownership. The original author and/or their authorized representative, Renovatio LLC, has transferred all relevant rights to Testberichtinstitut LLC in accordance with applicable copyright and publishing law. This ownership applies to all current and future uses of this work, including audio, video, and digital publications. Effective date of rights ownership: the 1st of February 2026. Any unauthorized use, reproduction, re-upload, redistribution, or claiming of this content is strictly prohibited. Copyright Testberichtinstitut LLC. All rights reserved.